My name's Jamie, I'm 23. I've got pulmonary atresia with a VSD, which I've had many surgeries for to try and correct that. I was born with this condition but not diagnosed till I was about 3 or 4 months old, and I've got plenty of scars that show that off, so to speak. When I was younger, I remember when I was about 3 or 4, my mum would have to do kind of bag and mask type thing to bring my oxygen levels back up when I was younger, when I was around the house. Or I also remember being at nursery, just trying to play kind of football or run about with other kids and having to stop after only a couple of minutes to get my breath back. And I remember being told a lot of the nursery nurses had to run me to a window to get my breath back at times, but that's probably the earliest memories. It's quite hard at times, purely because I wasn't able to keep up with a lot of my mates doing stuff like football or rugby. I was never big enough to play rugby because of it, but I had the ability, but just not the size, and that was never going to change at that age. And a lot of fitness levels, I wasn't able to get to that standard. So if I was playing with my mates playing football, I'd have to stop quite quickly and end up going home before everyone else did. So times like that, it was quite hard. At the moment, it doesn't really affect it now. I've had the surgery, obviously it disrupted quite a bit of my life and my education. I'm training to be a paediatric nurse, so having to stop education, I'd already come out for a year and I didn't want to do that again, so having the operation meant I could qualify and then go straight into a job after the operation. So it has disrupted things a wee bit, but in the long run it's the best. And relationship wise, there's no problems. I think I don't want to be treated any different, and my partner and my family don't really treat me any different to anybody else. I've got quite a few hopes. My plans are to try and go back to sport when I'm able to. I'm still recovering and I'm still working on my fitness and getting back to a standard I can attempt to play sport. I'm also looking to qualify as a paediatric nurse, and take that in and get a job as soon as I can, which I had an offer before the operation, so I'm looking to reinstate that when I'm finished. I'm also getting married, so I'm looking to start a family when I can, after I've got that kind of sorted in my life in order almost. Not a lot kind of scares me. The only things are kind of minor worries, such as if I do start a family, like my partner's got a small heart defect, so kind of things like worrying about having family, if they're going to have a condition that could be worse than mine or the same as mine, like that kind of worries me, which obviously I know we'll find out closer to the time if that happens. But the only other worry is when I'm getting older, like how it will affect me when I'm older, kind of in my 60s, 70s, what condition I'll be in then. I knew from a young age I was never going to be a footballer or a sportsman or anything like that, which I would have loved to do personally, but everything else is just realistic. There's no certain things I've been told not to do, and the doctors have always encouraged me to do whatever I can, and know my own limits, which is something I just do myself. With employers, it's quite hard because obviously the minute they hear someone's got a heart condition, they worry if anything happens. Or, for example, I still get some muscular pain from time to time when it's not to do with my heart, it's to do with the muscles in my chest, just from the surgeries I've had. And they kind of panic, and every time if I ask for painkillers, if I don't have any on me, I've been sent up to A&E a few times. They don't listen to me, myself, when I know it's nothing to do with my cardiac problem. So that's one of the main problems, is people listening to you and knowing your own body. I just see myself as anybody else. Like, there's nothing I want to kind of shout about my condition. It's dealt with as far as I'm concerned. It's well managed through the hospital. I don't see myself as being any different, so I wouldn't really shout about it because it doesn't define who I am.